Hello everyone, Yordanos and I will be discussing Maria's binge eating disorder for our case study in Service Delivery Systems and Interprofessional Practice course. Maria is a 38-year-old divorced woman who works for a large federal agency. She is well established in her career and has several close friends. However, she came to a psychiatrist after unsuccessful attempts to get appropriate treatment for her binge eating. It started when her college counseling focused on working through her sexual assault issues rather than binge eating. Embarrassed by the situation, it took her years to seek help, wherein the physicians were recommending her to meet with a dietitian, but she needs help with her control and consistency in eating healthy. Her history of binge eating started in college when her weight increased 25 pounds in 4 years. She has been in treatment for hypertension and high cholesterol for 5 years. Currently, she is coming for help with her physician's recommendation as she is experiencing problems with back and knee pain due to her excess weight. To provide Maria with the appropriate treatment, she needs to seek help with a physician, psychiatrist, dietitian, behavior analyst, and a physiotherapist. However, there might be a power hierarchy that may exist between these professionals. As seen in the slides, we place a pyramid to symbolize that hierarchy. Most of the time, the physician and psychiatrist will usually perceive the needed treatment due to its utmost guidance in Maria's physical and mental well-being. On the other hand, the dietitian, physiotherapist, and behavior analyst are equally crucial in supporting Maria in her rehabilitation. However, if any physical and mental symptoms exist, it will go back to the physician and psychiatrist.
Theoretical position of each professional. So as you all know, ontology, so in the nutshell, ontologies are frameworks for representing shareable and reusable knowledge across a domain, and their ability to describe relationships and their high interconnectedness make them the basis for modeling high quality and linked and cohort data. And so under this philosophy, dietitian, psychiatry, physician, and a physiotherapist would operate, and whereas epistemology is more on the study of knowledge acquisition, and it involves an awareness of certain aspects of reality, and it seeks to discover what is known and how it is known, and it addresses cultural studies as well as history of science. And so under epistemology we put behavior analyst. The role of a physician is to identify and assess the diagnostic of Maria using the medical models, and some of the assessment method that a physician would use includes asking diagnostic questions, and some of the screening tools includes eating disorder diagnostic scale, eating attitude test, and the physician would also observe any physical symptoms of the body. These are general appearance, vital signs, BMI, blood pressure, EKG or X-ray. And most of the treatment that the physician will apply includes use of pharmacology or prescription of drugs. These are related to weight loss or comorbid depression or anxiety. And a physician would also use self-therapy, which might be beneficial to Maria by self-monitoring the activities or teaching problem-solving skills. And also a physician would educate Maria and her family or peers by providing resource lists, support group psychoeducation. However, if the behavior is not within the physician's scope, and a referral to an appropriate specialist is needed. The psychiatrist's role is to assess the onset of binge eating using assessment tools such as eating disorder examination, which is a semi-structured interview regarding dietary restraint, eating concerns, and weight concern. Eating disorder inventory is a self-report to assess psychiatric symptoms such as emotional dysfunction, self-esteem, and social insecurities. Binge eating skill is also used, which is structured clinical interview to assess emotional and cognitive process implicated in binge eating. And some of the treatment that a psychiatrist would use to help Maria understand her thoughts, emotion, and behaviors that might trigger binge eating include psychotherapy, which is also known as a talk therapy. And under this treatment, there are cognitive behavior therapy, which would help Maria have a sense of control over her behavior and regulate eating patterns. Interpersonal psychotherapy would also help Maria reduce negative emotion that might trigger binge eating due to problematic relationship. These relationship could be at home, at work, or with friends. Dialectical behavior therapy also teaches Maria some of the behavioral skills to tolerate stress, regulate emotion, and improve her relationship with others. However, often psychiatrists would combine psychotherapy with drugs. And so, for instance, fluoxetine and sertraline are usually used for ADHD, but it can also be used to treat binge eating disorder. And topiramate is normally used to control seizure, but it is also used to reduce binge eating. And lastly, behavioral weight loss is also another treatment that can be used. And since Maria have failed attempt to control her binge eating, a weight loss program might be used in combination with CBT to address binge disorder.
The dietitian can help Maria by educating her about her current nutrition and the implications of binge eating disorder. The dietitian will use different assessments to confirm the diagnosis of BED, such as identifying nutritional problems relating to the medical or physical condition. That could be through the form of evaluating the medical history and recent blood test, using anthropometric measures by measuring the height, weight, and history of Maria's eating patterns. In this way, the dietitian will compare it to the normal range according to her age. The dietitian will also evaluate dietary assessment. So the dietitian will conduct an interview or assessment test to identify the eating pattern and her core attitudes regarding weight, shape, and eating behavior. The dietitian will then implement different possible treatments for Maria. Nutrition education will be implemented to talk to Maria about her nutritional needs, physical and psychological consequences of BED, and her emotional relationship with food based on her previous trauma. The dietitian will also help her in setting realistic goals and expected weight, and help her to have a normalized eating patterns through nutrition rehabilitation. She will then provide counseling sessions to Maria and the people surrounding her based on the preferences of Maria in coping and also the different resources that they can access. Maria can also seek a physiotherapist to relieve her back and knee pain due to her excess weight. The physiotherapist will assess Maria by interviewing regarding her chief complaint, purpose, and past medical history. The physiotherapist will then use a physical assessment wherein they observe Maria in an inactive motion by moving independently or passive motions through moving with the help of a PT. In this way, the PT can evaluate the range of pain and the needed intervention for her. The possible treatments that may be implemented for Maria can be educating her on different exercises to alleviate the pain. Some of these exercises may include lower back and knee strengthening exercises, deep breathing, and aerobic conditioning. Also, she may need to book an appointment for passive therapy, using various modalities such as TENS unit, ultrasound for therapeutic purposes, and or massage. Lastly, a behavior analyst can provide intervention to Maria and her behavior of binge eating and its relation to the environmental events. The BA can assess her behavior through functional analysis by conducting a formal interview with the client to identify the function of the behavior, using the three-term contingency, which is antecedent, behavior, and consequence. The BA or Maria can observe when the BED happens, the common situations before it, and the consequences that may maintain the behavior. Moreover, the use of a food diary can also help track the periods of binge eating episodes and the frequency of antecedent and consequences situations. However, the behavior intervention depends on the function of the behavior, specifically if it is antecedent or consequence-based. An antecedent-based stimulus control may include limiting the access of calorie-dense food in her kitchen, minimize the opportunities for meal snacking by implementing an alternative behavior, preparing small amounts of food in advance, or observing and recording her behavior through self-monitoring procedures. On the other hand, the consequence-based intervention may be alternative sources of reinforcement or relapse measures by accepting what happened.
So for the navigation map, Maria would go to a physician, and the physician would do the assessment using blood work, interview, or BMI, and would diagnose Maria with binge eating, overweight, or trauma, and then they would have their own treatment. So the physician is the one that would do the referral. So a physician would refer Maria to a psychiatrist, dietitian, psychotherapy, as well as a behavior analyst. And so all these professionals would have their own assessment tools and treatment plan. So for instance, a psychiatrist would assess Maria using eating disorder examination, binge eating scale, and the treatment that a psychiatrist would provide are pharmacotherapy and psychotherapy, whereas a dietitian would assess Maria using eating patterns and height and weight, and they have their own treatment that would be nutrition education and psychosocial support, whereas a physiotherapist would assess Maria using interview, vital signs, and physical assessment, and the treatment plan that would provide to Maria includes exercise, whereas a behavior analyst would assess Maria using functional analysis, formal interview, and would more assess, the antecedent and consequence, and the treatment plan would be based on antecedent strategy or consequence strategy. So attention might arise in an interprofessional team as these professionals with various ontological and epistemological theory as the core of their profession. So therefore, the treatment plan of one profession might undermine the other. So for instance, a psychiatrist emphasizes more on the mental, emotional, and behavioral aspects of Maria's binge eating, and their treatment plan would aim to avoid these mental or emotional triggers that result her engage in binge eating, whereas a behavior analyst would focus more on environmental factors that results Maria in engage in binge eating behavior. So therefore, the treatment plans would focus on altering environmental strategies instead of these mental or emotional state. In addition, in a psychiatrist's comorbidity, medications are used to prevent anxiety or depression. And since these drugs have side effects, it might interfere with the treatment plan of a behavior analyst. And furthermore, dietitian works side by side with a psychiatrist, which might result the behavior analyst treatment plan as a last resort. And lastly, there might be a tension between a psychiatrist and a physician. As Maria is experiencing health concern, the side effects of these drugs prescribed by the psychiatrist might escalate her health problems.
We will now move forward in comparing and contrasting the different professions. We will start at the commonalities.
So there's commonalities between psychiatry and a physician. So for the assessment, both a psychiatrist and a physician assess Maria's health before prescribing any medications using structured interview or other assessment tools. And both psychiatry and a physician can provide diagnosis. So when it comes to the treatment, both take into consideration of Maria's health condition before implementation of any treatment plan, and also they both can prescribe medication to treat Maria, and both monitor Maria's health condition during treatment and the effect of prescribed medication. And lastly, they both educate Maria and her family about binge eating disorder. So the commonalities between a psychiatry and a behavior analyst is that they both assess Maria's binge eating disorder based on the three-term contingency, which is the antecedent, the behavior, and consequence. They identify specific antecedents that might trigger or that might lead to the target behavior, or a consequence that maintained Maria's binge eating behavior. And they both record data to monitor Maria's eating patterns. And so for the treatment, they both use antecedent or consequence-based intervention to treat Maria, and they both record data to monitor treatment effect.
One of the commonalities of physicians and dietitians is determined in how they assess Maria and the needed treatment. For the assessment, both of these professions measure and assess the health-related factors of the individuals before the diagnosis. In this case, they will have a sufficient knowledge of what Maria needs specifically in nutrition to move forward with the intervention. For the treatment, both of the treatments involved nutrition-based intervention wherein they calculate and monitor the macronutrient needs for Maria. Moreover, they offer counseling sessions for Maria and the people around her by providing awareness and education of her situation while giving the needed resources for additional guidance. The behavior analyst and dietitian assess Maria based on the relations of the environment and eating patterns. They use assessment methods that include observing and collecting data based on what events that may trigger the behavior of BED and the influence of the social environment in maintaining her behavior and the perception of her body shape and diet. Both the treatment includes target goal setting and reinforcement to restructure a nutrition eating plan. Both also consider her physical environment in making a structural plan that would be appropriate for her. It is through either checking her budget, time, and motivation to succeed. Moreover, both would consider her preferences and opinions in the plan. Physician, dietitian, and physiotherapist measure the physical aspects of Maria as a part of assessing the diagnosis. These assessments can include BMI, height, weight, and vital signs. They would refer to these health records in moving forward with the treatment. We will now move forward to the discrepancies.
One of the major discrepancies in treating Maria's binge eating disorder is what behavior should be treated first. So for example, if we take trauma, the psychiatrist may focus on what happened or the triggers associating with the behavior based on mental cognition, and hence the psychiatrist will more likely to treat with the trauma of sexual assault, as it can help with the treatment of binge eating disorder. The dietitian may also agree, as they can assess emotional connection of the food in Maria's emotion. Moreover, the prescription of drugs needed to alleviate the comorbid depression or anxiety might also be taken into consideration. In this case, the physician will also relate to this treatment.
On the other hand, the behavior analyst may say otherwise, by taking into account the environmental factors that may trigger and maintain the behavior. Most of the interventions that will be included refer to the environmental enrichment or self-monitoring. By manipulating the environment, Maria will have a minimum contact with her triggers. Moreover, self-monitoring will increase her motivation as she can record and see her progress. Lastly, the BA can implement alternative behavior to replace the binge eating disorder. In this case, the dietitian can help the BA in providing sufficient knowledge regarding the nutritional value of the food that Maria should eat. This will also be helpful in planning her meal based on the resources that she has. On the other hand, Maria should also allocate the time needed for physiotherapy treatment. Although this treatment is needed to alleviate the pain, there might be cases wherein her schedule and physiotherapy treatments may interfere with her progress in other treatments due to different contingencies, such as distraction or temptation to other stimuli.
So all of the discrepancies can be combined with the help of clear communication between the professionals. And so one of the discrepancies that may arise is the use of pharmacology during intervention. And so the medication prescribed to Maria and its side effects may affect her behaviors and emotion towards treatment plans implemented by other professionals. And one example for this could be that, a psychiatrist may prescribe topiramate, which has dizziness, nervousness, sleepiness, and trouble concentrating as side effects. And so these side effects can affect the ongoing intervention of the behavior analyst, dietitian's nutrition plan, and exercise referred by the physiotherapist. And so the discrepancies can be resolved when all of the professionals would communicate and adjust the prescription to fit the needed plan.
And for the dynamics of interprofessional team affecting treatment and its solution. One issue in the dynamics of the interprofessional team is the lack of communication between the professionals. Maria is an outpatient, which means that she needs to go to other private practices to access sufficient treatment. Due to this, there might be communication issues due to less frequent meetings than treating in the same facility. Moreover, the professions may use technical terms to describe Maria's diagnosis, resulting in more clarification for all sides. For example, some of the mentalistic terms may not be understandable to the behavior analyst and vice versa. This will hinder the process and planning of treatment needed for Maria. So, to resolve this, the professionals should set a time to discuss and evaluate the appropriate treatment. All of the professions should use non-technical terms for straightforward communication. In this way, the professions can compromise with the plan by considering Maria's different points of view.
Another issue in the dynamics of interprofessional team might be the lack of awareness of other professional service available. So when Maria had her appointment with the physician to ask for help, the physician should be competent and aware of the factors that may not be within her boundaries. Thus, the physician will then refer her to a specialist. However, if other professionals or other specialists are not aware of other treatments that are available, the scope of the treatment may not be sufficient for Maria. And to resolve this, the physician should attend a class that explains the professionals involved in interprofessional team and their responsibilities. So in this way, the treatment will be client-centered. And so on the next slide, we have the references that we used. Thank you so much for tuning in. This will wrap up our presentation.